At UT Southwestern, my colleagues and I from the Smoking Cessation Program, School of Public Health, and the Cancer Center did a study where we analyzed survey results from tens of thousands of US adults, asking them about their perceptions of electronic or e-cigarettes compared to regular or conventional cigarettes. Over time, their perceptions of electronic or e-cigarettes changed dramatically. At the beginning of the survey period in 2012, only about 3% of adults considered e-cigarettes more harmful than conventional cigarettes. But by the end of the survey period that we looked at, 2022, 10 years later, that it increased to 30%, a tenfold increase. And at the same time, the proportion of adults who considered e-cigarettes less harmful fell from over 50% to less than 20%. So while we recognize it will be a long time before we understand the long-term health effects of e-cigarettes, I think most physicians and most researchers would agree that they're probably less harmful than regular or conventional cigarettes. So what happens if more and more people think that e-cigarettes are not less harmful or maybe even more harmful than regular cigarettes? Well, two things can happen. First of all, people who are currently smoking e-cigarettes might be more likely to go on to smoke regular cigarettes. And we're especially worried if that's going to happen in young people. And secondly, people who are smoking regular cigarettes who otherwise might have used e-cigarettes as a way to move towards smoking cessation might continue smoking regular cigarettes. And in both of those situations, we wind up with more people smoking regular cigarettes than might have otherwise been the case. And that's likely to be harmful to the public health.